Good morning, and welcome to our continuing series on homeopathy with Dr. Pachegaonkar, our dear friend. Namaste. Today is an interesting subject because it's PMS, and I remember reading in Tara Johar's book, Growing Up with the Mother. Mother made some comments about it. You probably are aware of these.
Yes.
That it wasn't a big thing or something like that. I don't remember exactly. But I have known many people who have suffered greatly. Can you enlighten us?
See, to understand premenstrual syndrome, we have to understand the physiology of menstruation. In adult female, almost every month in either of the ovaries, one ovum starts getting matured. And once the ovum is matured, the Graafian follicle ruptures and releases the ovum, which is ready for fertilization. And when this ovum doesn't get fertilized with the male zygote, then the preparation in the uterus to receive the fertilized ovum is futile. So after 14 days, whatever preparation was there in the uterus, in the mucosa mainly, it is desquamated, in the form of menstruation. And so that again a fresh preparation is done for next ovulation. So this is a physiology of menstrual cycles in female.
Can you give some ideas of timing?
See, on an average it is 28 days. This cycle follows 28 days, but we consider 25 to 32 days as a normal.
Okay.
And exactly when the ovum is like Graafian follicle ruptures and releases ovum, exactly after 14 days the desquamation takes place if there is no fertilization. This is well calculated. So depending upon the rupture of the Graafian follicle and the fertilization of the ovum, the next menstrual date is fixed. So like 14 days.
Okay.
It may vary like every 25 days or even every 32 days. In this what happens, because the ovum is getting released, there are a lot of hormonal changes occurring during ovulation. Even the body temperature is raised by almost 1 degree during ovulating period in females. And when the female has to desquamate in the form of menstrual bleeding, around 60 ml to 100 ml bleeding takes place in 3 to 5 days, even up to 7 days. That would vary from individual to individual.
Mm-hmm.
So everything is connected with the hormonal changes in the system, depending upon there is a very precise feedback mechanism. So during this period, some females who are very sensitive, actually the phenomena goes imperceptible. In normal course, on an average female, this menstrual cycles and ovulation and menstrual bleeding, everything goes like in a imperceptible degree of subjectivity.
And this was what Mother was saying, I believe.
Exactly.
Yes.
But some sensitive individuals, they perceive all these changes and they react to it. So we have seen some females start getting breast tenderness much before the period, and as the flow starts, the premenstrual syndrome fades. They get diarrhea, they get mood swings, they get lumbosacral pain, they get abdominal pain. So this is very common, but in general it is to the imperceptible degree, or what we can say is within the pain threshold of the individual. So one doesn't need much treatment. Sometimes if the person is having low vitality or sick because of some other things, then the amplitude of this PMS is magnified, and therefore there are acute symptoms. So we have seen females going in depression, they start crying, they get mood swings easily. Then, as I told you, even breast tenderness starts.
What about acute pain?
Generally, as a PMS, one doesn't get acute pain unless it is associated with sort of a endometriosis or other inflammatory conditions in the pelvis.
Ah,
Premenstrual syndrome, as such, should not be that painful or it should not be intolerable. But if it is associated with some sort of a endometriosis or other inflammatory conditions, then it is painful. And especially we have seen some what we call primary dysmenorrhea in girls. It's terrible. They just can't bear with it. But somehow this primary dysmenorrhea disappears in the female after the first conception. Just first conception and this primary dysmenorrhea disappears. But whereas if the pain is because of endometriosis or other similar inflammatory conditions, then those conditions will have to be treated.
so you really don't treat for PMS?
Yes, actually in homeopathy task is very simple. We don't treat based on the diagnosis
Of course,
at all.
yes.
But we have seen that these symptoms, like for a few females feel bloated before the menstrual cycle, breast tenderness. So the amplitude of the complaints is definitely reduced and it is brought to the what we call a imperceptible degree. Female just gets a warning that one would be having period. Beyond warning, no discomfort is felt. That much we can treat. Rather, we have certain remedies which are actually selected based on PMS. Because premenstrual syndrome is like a general symptom. It is not necessarily associated only with the uterus or ovary. Because a lot of complexities are involved in these menstrual cycles. So we consider this as a general symptom in the person and which characterizes so many remedies. For example, we have one remedy called lachesis, that deadly snake poison. From that we have prepared a medicine. This medicine many times we give based on this indication. We can call it like prescribing symptom or eliminating symptom. In the sense, if the female doesn't have PMS and is comfortable before the period, we consider that lachesis is ruled out. Because this symptom is invariably there in lachesis where the female has lot of discomfort before the menstrual cycles, and as soon as the flow starts, all the complaints are relieved. This is the characteristic of the remedy. Of course, there are many remedies with this, but if other symptoms of lachesis are matching and this is the symptom, we don't give a second thought at all. This is the remedy.
I see. I understand. I don't really understand very well, but I've been told that maybe you could clear this up. When does conception occur with the male?
It's, as I told you, the ovulation day varies depending upon the like what would be the normal interval in that person at the given time.
Yes.
So when the matured ovum is ruptured, the Graafian follicle gets ruptured and the ovum is released, the female also starts releasing hormones in such a way that she longs for copulation.
Okay.
A natural instinct. And 2, 3 days, 4 days even before ovulation, if there is coitus and the male sperms are in the female generative organs, that environment during that period is so conducive for the life of the sperm that they wait for ovum to come through the fallopian tube.
I see.
So generally if the couple has intercourse even 3 days 4 days in advance,
Before.
the sperms can be live and waiting for the ovum to come and
see.
get fertilized.
I,
Generally 14 days before the menses is the day of ovulation on an average. It is not after the period. We consider 14 days before the period is the day of ovulation, and that is supposed to be the best period for sperms to survive.
I have two very dear friends who are very spiritual people. They wanted to bring down a very special soul, and they timed everything according to what you're saying, and that soul has come down. I've seen the child.
Yes, that is what we suggest. What we do is we just calculate the average interval for last say 4 to 5 periods, menstrual cycles. Suppose that cycle is say 30 days. So 16th day is the day of ovulation, because after 14 days you get menstruation. So 16th day we consider the best day for conception. So we advise like 3 days in advance the couple to have coitus every
3
day.
days before ovulation.
3 days. So for 4 days we advise up to the day of ovulation. So like 13th, 14th, 15th and 16th day, these 4 days we advise. Generally where the couples find that sort of infertility like symptom, where like they were not, the female is not conceiving, we advise them to be together for 4 to 5 days without any disturbance. So that together the female also starts developing the longing, and that environment is very much conducive for sperm to be healthy for waiting for the ovum. So this is a natural thing.
And the sperm, of course, there are thousands of sperm.
Millions.
Millions of sperm.
Millions of sperms.
And enough of them survive those 3 or 4 days.
Yes.
To create
Yes,
fertilization.
the nature has is organized in such a way that period, close to the ovulation, that period the environment in the vaginal pouch and even in the uterus is more favorable for sperms to survive longer in a healthy tone.
Interesting, very interesting. So women who have some pain or acute pain, it can be from other symptoms.
Yes. If it is associated with the menstruation, it can be what we call endometriosis, or there are like several conditions where we say the pelvic inflammatory disorder. So many other conditions are there. In some females, even ovulation is becoming irregular. What we call ovarian cysts they form.
Yes.
In fact, what happens, every month there is one Graafian follicle in either of the ovaries coming to the maturity. And once it is matured, it ruptures. But sometimes because of some hormonal changes or even stress, the Graafian follicle doesn't rupture only. It doesn't rupture. So ovum is not released. And because it is not ruptured, it is not released, the preparation in the uterus can't go on waiting for it to rupture. So after waiting for a while, the menstrual flow starts even without ovum being released. And it remains as a cyst, and once the menstruation is there, what we can call it anovulatory cycle, and then again it gets ready, and sometimes the other ovum becoming ready in the other ovary or the same ovary, again that starts maturing, and that again may not rupture. remain as cyst again. So we get irregular menstrual cycles in such cases, what we call polycystic ovarian syndrome. It's very common. Therefore, if the female has cysts more than 10 in number, then only we label the female as having PCOS. Otherwise, one or two cysts are very common. And sometimes these cysts also develop sort of a inflammation, and that also is a very painful condition.
Oh, I see.
And especially females who are under stress or working, or like the working women, they are the commonest prey for being PCOS cases.
I see.
Very common.
Because of the level of stress, or
It's
or
actually
activity?
their own susceptibility to stress. Mainly the activities, they get carried away. They are not like what we call little bit of self-centeredness.
Mhm.
From the health point of view, is to be there. Like I have seen some females who are working women. Their sleep timings, their breathing exercises, no physical exercises, food timings, they eat junk food, and they get carried away so much for the career, and so much ambitious they become, they just forget or ignore their even femininity. I have published one wonderful case in Nama, in our journal. Like the lady was working in information technology company, and she was not conceiving. She had developed this PCOS as well as endometriosis, and this polycystic ovarian disease. They said that we will tackle it by aspirating all those cysts. So under laparoscopic intervention, they aspirated all the cysts, so the cysts get collapsed. And they said, now you may not develop. But within 8-9 months again she had same cysts develop. And then she came to homeopathy. We advised her a healthy lifestyle along with homeopathic medicines, and within 6 to 7 months she conceived. And there she that news of conception was really a positive shock for her, and she developed again sort of a bleeding, spotting PV, like a threatened abortion. And the remedy aconite napellus, it's a deadly aconite napellus
Aconite is
that we
very-
gave,
yes.
which gives what we call a shock. It gives like a after effects of any shock. And then that aconite did help, and she delivered the baby after 9 months.
Interesting. It's a very interesting session. Thank you so much, Sam.